Hi everyone, my name is Aubriana Peace, and I just want to take a moment today to discuss with you all something that I feel the more you know about, the better you are able to protect yourself. And what I'm talking about are sexually transmitted diseases. Now, I know in America it can be a bit taboo to have any discussion involving sex, but in this case, the discussion is well worth it. And so let's just start with the basics. Sex. What is it? We all know what sex is, what you do, what can come about of sex, and typically most people's thought is pregnancy, right? People worry about becoming pregnant or getting someone pregnant before either of you are ready to be parents, and that's understandable. But something else that you should be concerned with if you are engaging in unprotected sex is the possibility that you can contract a sexually transmitted disease. Now, I know the mindset of most college students is those aren't even common. I make wise choices. That can never happen to me. But you really should think again, because 1 in 4 college students in America has a sexually transmitted disease. And in fact, in recent studies conducted, less than 54% of college students admitted that they regularly use condoms when engaging in sexual intercourse. So less than 54% use condoms. With that being said, what is an STD exactly? I want you all to be aware of what it is, how common it is, and some of the symptoms of STDs so that you are able to better protect yourself against them. And then towards the end, I'll just give you a few tips on how to prevent them. So again, what is an STD? A sexually transmitted disease can be known as an STD, an STI, a venereal disease, and those are all really just defined as a variety of about 20 different infections that can be transmitted through semen, blood, and other bodily fluids from sexual acts and contacts with other people. Now, in here, I do mention a couple STDs that can be contracted asexually, but I'll definitely let you know which those are when we get to them, okay? That being said, just a little more information for you about the prevalence of STDs here in America so that you're not under the impression that they're not common, because they are. 19.2 million new cases of STDs occur in the U.S. every single year. And of those people, over half are between the ages of 15 and 24. So if you find yourself in that age bracket of 15 and 24, then this is really intended for you. In addition to that, for every 2 people, 1 is going to contract an STD before the age of 25. So before 25, half of the youth will have contracted an STD. You just want to be careful, okay? That being said, what are some of the most common STDs that you should look out for? Those are really going to be like chlamydia, gonorrhea, syphilis, HIV and AIDS. Those are just some of the common. Now, granted, there are more you should be aware of, but these are just the few that I'm going to give you some symptoms for today. So, chlamydia is actually the most frequently reported bacterial infection in the U.S. Happens the most frequent, and it can cause fever, weight loss for no apparent reason, burning when urinating. It can also cause fatigue, diarrhea, and then like white spots inside the mouth. Some of the female symptoms are vaginal discharge. That's of a grayish color, a white or gray color. Also burning when urinating and itching around the genitalia, possibly spotting between periods, and then lower abdominal pain. For men, it's some the similar discharge that is white and or gray from the penis, as well as burning when urination, and you might also get swollen testicles and contract a low-grade fever from that. Gonorrhea is the next on the list, and it actually uniquely can spread to other areas of the body. So gonorrhea doesn't just stay in the infected area, it spreads throughout. So it can appear anywhere between 5 and 7 days, but it can also, symptoms might not also appear for at least 30 days after contracting the disease. And if you have engaged in oral sex with someone who has gonorrhea, you can get gonorrhea of the throat, which will result in a sore throat, a red throat, spotting in the mouth, things like that. If you engaged in anal sex with someone that has gonorrhea, you might notice blood or pus in your stool with every bowel movement, and then you might have like a swollen rectum from contracting gonorrhea of the anus. Some of the female symptoms can appear between about 2 and 21 days, and again, they are common with vaginal discharge, like yellow vaginal discharge, as well as lower abdominal pain, bleeding between periods. So if you notice some spotting, and then burning when urinating, as well as itching around the genitalia. For men, it's some of the same again, a white or yellow discharge from the penis. You might experience burning or pain when urinating, frequent urination possibly, and then even swollen testicles. Syphilis was actually a disease that was really common about 40-50 years ago, and it started to get on the decline, and then all of a sudden it's really come back strong. So while syphilis was uncommon not that long ago, it's actually a really commonly contracted STD now, and it's one that you should be aware of. It is something that can, if untreated, can result in fatality. So over a very long period of time, meaning years and years and years, if you have syphilis and you are not treated for it, it can become deadly. So just be aware of that. It also comes in 4 stages. So stage 1, symptoms usually occur between 10 to 90 days. You'll have, and that's in coming in contact with like the sores, syphilis sores. You can get the sores yourself. It also comes with, itching, and it might have like a body rash. And then usually within it lasts about 4 to 6 weeks, and then it appears though like it subsides. Then stage 2 occurs, and this lasts about 3 to 6 weeks, and you'll get like a copper color skin rash everywhere, and it can get like the palms of your hands, your feet, areas like that, more noticeable areas, and it can cause fever and headaches, loss of appetite, things of that nature. In stage 3, all the symptoms appear to disappear, so you almost seem to be cured because all your symptoms are gone. If you haven't received treatment, the bacteria remains in the body and begins to damage the internal organs, so the brain and nerves. I know one of the most common comparisons to having syphilis in stage 3 is like your brain becomes like Swiss cheese. Syphilis will start to eat holes in your organs, in your brain. And then the last stage, as a result of the internal damage from stage 3, after many, many years, so 10, 20, 30 years of the initial infection, you might get a sudden heart attack. And you might be able to notice mental disturbances just from the damage to your organs. So this one is definitely something that you want to catch early on. And then the last one that I'm going to mention today is AIDS and HIV. Now, I know I said I would let you know, these are the ones that you can contract asexually. So for using dirty needles to administer drugs, or having a blood transfusion, or maybe an organ transplant, you can contract AIDS and HIV without any sexual contact from people. This is the most misunderstood of most STDs, so I definitely want to make a point to let you know that AIDS and HIV can only be passed through blood, through bodily fluids like semen, breast milk, and then vaginal and penile mucus. You can't get it from other people's saliva or things like that, so don't don't fall under that misconception, okay? And then some of the symptoms are hard to determine because most people don't experience symptoms, and if they do, they describe them as the worst fever or the worst flu that they've ever had. So they'll get a fever, headache, body aches, loss of appetite, possibly rash, sore throat, things like that. And so you might think that you have contracted the flu, but it could in fact be AIDS or HIV. Some people have admitted that they haven't had symptoms for 10 years. They've had the disease and not known for 10 years. So this is a really important one to be aware of. The previous 3 that I mentioned, chlamydia, gonorrhea, and syphilis, the importance is to find those early because they can be treated. They are treatable. HIV and AIDS, however, is not. It's not curable. You can try and treat it with medication, but it's an incurable disease at this point in time. So now that you know what an STD is, how common it occurs, and what are the most frequent types, let's just discuss prevention quickly. The easiest way to prevent contracting a sexually transmitted disease is to practice safe sex, and that is to wear a condom every single time that you have sex. You can also limit your number of sexual partners. That brings down the chances of you getting an STD, as well as practicing mutually monogamous relationships. Those will also lower your chances of contracting an STD. If you visit your doctor regularly and get checked, that is something that's very important. Whether you think you have an STD or not, going to the doctor and getting checked can let you know if you do have one, and if you do, catching it in the early stages is crucial. And then I know, just thought I'd mention it, abstinence is also an option. Not having sex at all will definitely prevent you from contracting an STD in any instance, just about. So now that you all know some background information about STDs, I really hope that you all take an opportunity to really think about having protected sex. If you are engaging in unprotected sex, really think about what I've said and how common STDs are to get, and know that you can prevent them. So thank you. I just want to thank you all for your time.